I'm Aisana and I'm the clinical lead for eSurgery, and today I'm joined by my co-host.
Hi, I'm Dr. Mike Brooks. I'm an emergency medicine doctor and I advise on various treatments available.
We're excited to bring you this special episode focusing on one of the most talked about medications in weight loss management, Monjaro. Today's episode is actually driven by our patients' questions. We recently reached out to our patient community asking what they want to know about Monjaro, and we received some fantastic questions that we'll be addressing today. Before we dive in, just a quick reminder that while we are providing general information, it's important to always consult with your healthcare provider about your specific situations. So, Mike, let's start with the basics. One of our most common questions about Monjaro is actually how it works in your body.
Sure. So it's got a complicated name. It is a glucagon-like peptide 1 agonist. It's also a glucose-dependent insulinotropic polypeptide.
Okay.
It's basically got activity on two receptors in the body. What it basically is doing is it's mimicking the action of two minor hormones that you have in your body that are related to your sensations of feeling fed and the sort of state of your body with regards to its sugar levels and how much energy it's got. So the two hormones, you've got GLP-1. That's normal job is to make you feel as though you feel fed. So it reduces your appetite, slows down your stomach emptying because your body is in a state or believes it's in a state where it's got enough energy and therefore doesn't need to rapidly digest stuff, boosts insulin and reduces glucagon. Insulin takes glucose out of your bloodstream into cells. Glucagon does kind of the opposite, takes from starch stores and puts it into the bloodstream. So insulin goes up, glucagon goes down. So that's your GLP-1 activity. And then your glucose-dependent insulinotropic polypeptide, that does kind of similar things. It increases insulin, it reduces glucagon. It does help put a bit of energy into fat storage, but actually the bigger effect is on appetite. So the medication is mimicking these two natural hormones that you have in your body. It's mimicking those, and it makes your body think as though I'm in a fed state, I don't need any more food, and thus suppresses your hunger.
I see. Okay. So basically what it does, GLP-1 just tells your brain that you're just full, you don't feel hungry, and the GIP just helps with regulating insulin. Would that sound?
Yeah, regulating blood sugar, yeah.
Blood sugar, yeah. Okay, fantastic, lovely. What are the most concerns with the side effects of Monjaro?
Okay, so, well, first of all, whenever I talk about side effects, I like to set some perspective. So loads of things that you take have got side effects, and even a cup of coffee has side effects, causes palpitations, diarrhea, and things like that. So, and just because something has side effects doesn't mean that everybody's going to get every side effect, but it's like anything in life, it's a balance of risks. Some people will experience them, some people won't, some will get mild effects, some will get bad effects. It's very often a case of you have to try it to see. So that's and that applies to any medications with any side effects. Specifically for Monjaro, the more common effects are your GI ones, your gastrointestinal. So people will generally feel a bit nauseated or may feel a bit nauseated. They may have some vomiting. They may feel that sensation of intestinal upset, a bit of diarrhea, a bit of constipation. Again, not everybody, some people. They're the common ones. People can also feel a bit feverish, like they've got a mild start of a cold without the snotty nose. And one of the more common, but tends to be on the milder side, is alopecia. Now, people tend not to lose all their hair; they tend to have a bit of patches thinning. Again, it's not going to be everybody, but it can happen, and it has been seen. So they're the more common ones. There are some less common ones which can be more serious. So the more serious ones are things like an inflamed pancreas, so pancreatitis. That can be quite serious. It is uncommon though; it's unlikely. And there's also, if you are taking any other medications or any other substances that might lower your blood glucose, there is a risk that if you then throw in Monjaro, you are at risk of running a too low blood glucose.
Okay. That's really, really helpful. I think one of the other side effects that we've been getting in terms of feedback from our patients would be the feeling of fatigue. So would it be right to say because the body is just using its own sources of energy by, your body is constantly in a state of satiation. So you're not eating as much as you would normally be, and then you'll just go into a state of fatigue. Would that sound right?
I mean, it's hard to know what's the underlying cause of fatigue because fatigue has many different components to it. Mm-hmm. It certainly would be a reasonable explanation that you are, because we are adjusting the natural hormones in the body around your fed state. Yeah. Everybody's familiar with if you have a big lunch, you feel a bit sleepy afterwards. Yeah. When your body is switched on to sort of the rest and digest mode, there's less adrenaline floating around. There are less things that are keeping you alert and awake. Yeah. So that may be the modality of it. But of course, the medication itself may be triggering certain things in the body that make you feel tired. Some people can have slight reactions to it. It's, after all, a foreign substance. Any foreign substance you put into your body can cause components of the immune system to trigger, and that can cause fatigue. So I don't know what exactly the underlying causes of it are, and it could be that in two different patients, it's two different things. But what I would say is that it's a reasonable explanation that if you're in a fed state after a big lunch, you feel sleepy, it wouldn't surprise me if we mimic that state with a medication that people experience a similar thing.
That's a really interesting way of looking at it, I suppose. In my head, I would just assume you're not eating food, so you don't have the energy, but I actually never thought about it from the state of eating food and then feeling sleepy. I actually quite like that. So what would be, going back to the more serious side effects, what would you suggest to our listeners on how to recognize the signs of the most serious side effects and what to do afterwards?
So the two big ones then are pancreatitis and low blood glucose. But pancreatitis is the one that we worry about, not because it's common, because it can be serious. Although, if it happens, it can be treated. Symptoms are severe, continuous upper abdominal pain, especially pain that goes through to the back. Yeah. Now, I appreciate what severe is quite subjective. It's significantly, noticeably worse than bad trapped wind. It is pain of a level that you can't ignore. Yeah. It's often accompanied by vomiting and tenderness in your abdomen. So if you are vomiting, it's extremely tender because of the movement of your abdomen. So continuous upper abdominal pain, especially that goes through to the back, the severe, with vomiting, pretty much you definitely need to see a doctor. I would also say that anybody who's suffering from vomiting with persistent abdominal pain, even milder, if it's not going away after a few hours, especially if you haven't got another explanation for it, that needs a doctor's involvement as well, because it could be.
And would you suggest to wait till, for example, if this happened in the evening, would you suggest to wait till the morning to phone their GP or just call NHS 111 or straight to A&E?
I mean, if you're in the category of severe upper abdominal pain, my tummy is tender, any movement, any touching it is bad, and you can't ignore this type of pain. It's that bad. That's an A&E job. Anything less than that, I would suggest speak to 111. Yeah. Another symptom that may happen in pancreatitis is dehydration. So if you are feeling lightheaded, extremely thirsty, in addition to these, that is on the more worrying side and would tip me in the balance of saying go to A&E.
Are there any risks on account of continuous use?
So the short answer to this is that we're not aware of any risks for using it over a long period of time compared to just using it. So there are the known side effects, but there have been a series of very good randomized controlled trials called the SURMOUNT trials that have looked at people who have had this medication over a period of time up to 88 weeks. So that's a year plus, I think, 36 weeks. Yeah. So there were no additional things found in that period compared to the risks, that the side effects that were already known. So from what we can tell from the evidence that is available today, while you're on it, you've got the risk of side effects. When you come off it, whether you've been on it for a week, 4 weeks, or 88 weeks, there is no difference in the risks. We need to also bear in mind that when we're talking about any form of risk, we need to compare the take to do nothing scenario and the do nothing scenario. If you've, say, got quite a high body mass index, if you're in the obesity category, there are lots of well-established known healthcare risks of being obese. So The reason I'm saying this is because this is a relatively new drug.
Yep.
And with any relatively new drug, there is a possibility that some hitherto unrecognized long-term issues might come out because more patients have been taking it, and we might start to see, especially rarer things. So there's by no means a guarantee that there will never be something that we discover that demonstrates taking it long-term is a problem. There can always be that, and that's the case with any new and relatively new treatment. However, you've got to view that in context. So far, all the data shows of people that have been on this trial that taking it for 88 weeks doesn't seem to confer any additional risk to just taking it for a shorter period. And if it's helping you crack something like obesity, you're probably saving yourself of quite a lot of risk of additional complications of obesity by being on the treatment. It's the kind of weighing up argument that is a case-by-case basis thing. So yeah, short answer is we're not aware of any. There may be some that emerge in the future.
This is actually a really important question, and it's one that I possibly come across on a daily basis with our patients. They do worry about what will happen after they reach that specific 2-year period. So this is, I suppose, would be reassuring to them to say, look, this is what the data is showing us. It would be a case-by-case basis when you do reach that kind of milestone of 2 years.
Yes. So, there's a bigger question about how long can you continue things for. We only have data up to 88 weeks, and we have data for other medications that are similar. There's a medication called semaglutide that's a GLP-1 agonist. That has been established to be safe and effective up to 2 years. And putting that all together, that's where the 2 years treatment course comes from. We haven't seen long-term use problems with semaglutide. We believe, based upon a trial of lasting almost 2 years or 88 weeks, the best part of 2 years, on Monjaro, plus a similar drug where people have been on it for long periods of time, that Monjaro is going to appear to be the same, but we're not certain.
What are your thoughts around maintenance dose? So should the patient be on a specific dosage, or do they need to reach the highest possible dose of 15 milligram and then just stay on that for the time limits of 88 weeks? How would they manage this?
It's a good question because, again, we are limited by the evidence that is there. From what we've seen in the trials, the higher dose, the more effective, the more likely you are to A, lose weight, and B, keep it off. So the advice based upon data from the trial and based upon data from a similar drug, semaglutide, is that you should be aiming for the full dose, for the highest dose. However, once again, this is a balance of risks and benefits. If a patient is starting to get side effects that are becoming bothersome, especially side effects that might put at jeopardy their ability to continue the treatments, it's perfectly reasonable to say, I would rather stay on a lower dose so I know I can comfortably stay on it and achieve weight loss than shooting for the highest dose. So the default position for anybody is who's a candidate for Monjaro is you start at the lowest dose, you take it for 4 weeks, you then go up by 2.5 milligrams, you take it for 4 weeks, up by 2.5 milligrams. You keep doing that until you reach the full dose of 15 milligrams, or you reach a dose where you are starting to get bothered by side effects to the point where they might affect your ability to continue, and then you stay on that. And you stay on that until so that you can achieve weight loss and so that you can adopt healthy eating habits so that they become well ingrained into your lifestyle. That's the benefit of continuing on this for a period of time. And as I say, we know that it's more effective with higher doses, but there's no point in being upon something that you're not going to be comfortable or capable of taking long term.
At what point would you suggest that the patients need to stop using Monjaro?
So you're balancing two forces here. You're balancing the risk of, if you come off it, you're going to no longer have an appetite suppressant on board. So you are now going to be depending on the habits that you've built up while you are on the treatment, the healthier eating, better exercise to sustain your lower weight. That takes time. And so you need to have been on it a sufficient length of time for those habits to be ingrained. So for that reason, we like people just to continually stay on it rather than just to target a particular BMI.
Another question that the patients sometimes get frustrated by is, why am I not losing any significant weight on Monjaro?
Okay, so weight loss, we all like quick and easy fixes, don't we? You know, yes. We all like a pill that you can take and magic happens. You're going into your weight loss treatment of a situation where your body has too much energy store on board. That energy store needs to be used up to a certain extent for you to come down to a normal weight. Now, what Monjaro is helping with is it's stopping you from topping the energy stores up quite so much because you don't have as much appetite, don't need to eat, and it's doing some other bits to body chemistry. What it's not doing is it's not increasing the amount that you are burning. And that's where your exercise comes into. Now, the other thing is that if you have ended up in a position where you have got too much weight because of unhealthy eating habits, it's very easy to eat a lot of calories, very easy, especially with the food that's available. And it's quite easy to binge on foods, and that behavior can still continue, and it can exceed the ability of Monjaro. Even if you're not necessarily that hungry, you can eat things that are so calorie dense that even though you feel full as if you were to eat something less calorie dense, you're loading on a load more energy. Yeah. So you need to, in addition to Monjaro, adopt healthier eating habits. This doesn't mean being stuck on a salad diet. It means switching to foods that are perhaps less calorie dense, so things like fiber-rich foods. They'll fill you up, but they won't necessarily add much to the energy tanks. So we're talking vegetables here. To long-acting carbohydrates that will give you a slow-release energy, so you don't get a spike of blood glucose and then a crash later on and then the urge to eat again. Mm-hmm. You have something that's much more gradual. So grains are great for that kind of stuff. Tricks like switching from white rice to brown rice, standard pasta to whole wheat pasta can help improve the energy profile. And then cutting out processed foods. The reason we advise against processed foods isn't necessarily about artificial additives. It's just to make them taste good. Manufacturers add sugar and fat to them.
They do. Yeah.
Sugar and fat is a nice concentrated store of energy, and that's defeating what you're trying to achieve with Monjaro. It's a three-pronged fork. One is the medication, two is your diet, and three is exercise. Yeah. Because remember, you still have excess energy, and it's all very well dialing down the amount of calories that you're taking to start depleting the tanks, because you are going to be burning energy just staying alive. Yeah. However, you're not going to notice weight loss at a decent rate if you don't at least try to increase your energy output. And the best way of doing that is exercise. There's your third prong. Yeah. So it is Monjaro or a medication that's appropriate for you for weight loss. It's a better diet, and it's an exercise regime that doesn't have to be grueling sweat camp stuff. It has to be something that you can sustain. Yeah. What we mean by moderate exercise is brisk walking, going upstairs. Vigorous exercise will be running upstairs, cycling at a fast rate. Swimming counts as vigorous exercise. And then strength building exercises are things like yoga, Pilates, even just carrying bags of shopping.
While we're on the subject of lifestyle changes, what foods should our patients include or exclude from their diet to support their weight loss journey?
Yeah, so first of all, when you're doing dietary changes, don't do crash diets, and you need to think about sustainability, something you're going to be able to stick with. That's like priority number one. Mm-hmm. So there are no super bad foods. It's all about given a food, how safe is it to continuously eat, and how much can I eat before it becomes a problem? Mm-hmm. So in principle, the stuff that you are allowed to major on are things that are generally not very calorie dense. So stuff that's full of fiber fills you up and doesn't add a load of energy to the tanks, which would be turned into various energy stores. Long release stores of energy, long release forms of energy are great because spikes of blood glucose followed by crashes are kind of what stimulates you to eat again. Yeah. So if you can have something that's nice, slow release, that is great. So we're talking complex carbohydrates there. This is starchy foods, things like oats, grains, and you can help situations by switching to sort of whole grains instead of refined. So the reason why white rice is generally regarded as not a great food is because it tends to be quite rapidly broken down and you get a bit of a spike. Whereas if you switch to brown rice, it's just a lot more work for your body to break it down. The energy release is slower. You're less likely to feel hungry later on.
One question I would say that a lot of our female patients have asked about is the relationship between weight loss and menstrual cycles. Mike, this is something that can cause a lot of anxiety for our female patients. What are your thoughts around this?
So there's all sorts of things that can affect the menstrual cycle and therefore the regularity of periods. There's a very complicated interplay of lots of different hormones and predominantly four. And there's lots of different things that can affect those four hormones. So it's unsurprisingly, we don't fully understand how a certain rate of weight loss may impact periods. But speaking generally, we know that rapid weight loss can cause people to develop irregular periods, more weeks between periods, or even stop having periods. So we know that rapid weight loss can definitely cause that. Gradual weight loss is less likely to cause that, but because we are adjusting hormones in the body and they have downstream effects to these four critical hormones that deal with the menstrual cycle, it's very hard to know whether you as an individual are going to experience it. Safety perspective is that even if you are experiencing irregular periods or no periods when you're on a weight loss regime, as long as you feel relatively well, that's a good sign. That's the first thing. But if you are feeling unwell with it, don't ignore that. See a doctor about it, because it could be a side effect of the medication. It could be something else that's going on. The other most important thing is just because you've stopped having periods and have got irregular periods, it doesn't mean you are not fertile. So it's really important that you carry on with contraceptive regime if you've got a male partner, because it is perfectly possible to fall pregnant. So don't be misled by it. There's so many other factors involved here. It's quite hard to guarantee to somebody that they won't be affected, or if they are affected, that they will get back to normal.
That's really, really insightful. I suppose there's one way that you can track it would be using your period apps, or just keeping a diary of any significant changes within your menstruation cycle. And you mentioned contraception. So the recommendation would be that you need to be on a most effective contraception while you're on weight loss treatment.
Yes.
What would be the reason for that?
So there is it's the effects of Monjaro on potentially developing embryos. There's a lot that's not known, and when there's a lot that's not known, we are extra cautious. Pregnancy is a state where you generally need to carry excess calorie storage because you are helping a fetus develop, and that is something that consumes a lot of energy. So it's not helpful for fetus development to be on a weight loss journey. I would say that if your plans are to become pregnant, Monjaro is not the right thing to be doing right now. You need to be exploring optimal weights for pregnancy with somebody appropriately qualified in either a GP with special interest in that area or a fertility medicine gynecologist. So yes, it's not the right time to do that, is what I would generally say. And there are lots of unknown effects of a new medication. And just to define a highly effective contraceptive, that doesn't actually include the pill. The pill helps, but by highly effective, we mean something where we've taken out the human failure element. So we are talking intrauterine devices, whether it's the hormonal one or the copper one, implanted hormonal devices as well. Of course, surgical sterilization is another one. Or if your male partner has had a vasectomy and has had a proven effect of the vasectomy, they all count as highly effective.
So going back to kind of summarize the question from our patient who was concerned about the effect of Monjaro on the menstrual cycle would be to monitor it, record it, bring it to your healthcare provider's attention. If you are experiencing significant changes to your bleeding pattern, heavier than normal, or you've completely kind of have stopped your menstruation, it's really, really important to discuss this with your healthcare provider.
And don't assume that you're not fertile.
Absolutely.
We are now going to do a 5-minute rundown of what we have discussed.
How does the medication work? What does it do to your body?
Monjaro mimics two hormones that are in your body, GLP-1 and GIP. What it does is it makes your body believe it's in sort of the fed state, so it reduces your appetite, helps nudge your insulin up, and helps reduce another hormone called glucagon. The net effect is that you have a reduced appetite and you lose a bit of weight.
What are the side effects of Monjaro and how can it be managed?
The most common side effects are milder ones, GI ones, nausea, vomiting, constipation, diarrhea. There are more serious ones, such as pancreatitis and low blood glucose in people taking other medications. They're less common.
Are there any risks on account of continued use?
From what we can tell, whether you use Monjaro for a few weeks up to 88 weeks, the risks are no different.
What is the maintenance dose for e-surgery?
So the maintenance dose is ideally 15 milligrams every week, or if you're unable to tolerate that because of side effects, it's the highest dose that you can comfortably tolerate, and that continues for up to 2 years.
Why am I not losing weight? Why am I not losing any significant weight on Monjaro?
So weight loss involves 3 things. 1 is Monjaro, 2 is better diet, and 3 is a healthier exercise regime. You need to be doing all 3. There are a minority of patients who Monjaro simply doesn't work for, but that is a minority.
What foods should I include or exclude in my diet to support my weight loss journey?
So you want to be adopting healthier eating, avoiding the calorie-dense stuff. So you go for things that are fibre-filled, such as vegetables. Avoid things that are calorie-dense, fats, sugars, processed foods.
How much workout is healthy while on Monjaro?
You want to be getting towards the Chief Medical Officer's recommendations of 150 minutes of moderate exercise or 75 minutes of vigorous exercise every week, plus at least 2 sessions of strength-building exercise. If you can't get up to that, it's okay as long as you move towards it.
Does weight loss affect your periods, and what to do if they are affected?
It can do, and it can cause people, especially rapid weight loss, to become irregular periods or have no periods. Some people will not be affected, and gradual weight loss is less likely to do it. In any case, you do not assume that you're not fertile, and it is important on Monjaro to be using effective contraception.
What can be the reason for the effect of Monjaro slowing down?
This is actually expected. Monjaro generally, once you get up to the top dose, is more effective. As you shed more of your weight, your body has certain chemistry changes that start to oppose the weight change. And we expect you to go down to a new lower weight and stay on that while being on the treatment.
Should I increase my dose every month, or can I stay on the lower dose for a bit longer?
By default, you should be following the regime of going up by 2.5 milligrams per week every 4 weeks. However, if you find that you're limited by side effects, you can stay at that lower dose for an ongoing period of time.
Why protein and exercise are so important, and how to avoid muscle mass loss?
When you are losing weight, your body will be depleting its energy stores, and this comes from fat as well as from the muscle proteins. It's important to make sure you're replacing what's lost from the muscles, so the only thing you lose in the net effect is from the fats. So proteins and strength exercises maintain the muscles.
Can I take other medication to improve the side effects of Monjaro?
In an ideal world, the best thing is to try conservative things, to change how much you're eating, what you're eating, or pause the dose ramping, so stay on the same dose for a period of time and give it a bit more time to adjust. If, however, after that you still have problems, yes, there are medications that can help with nausea, constipation, diarrhea, but this is a judgment of how much risk and benefit there is of new medication versus staying on Monjaro.
What are the symptoms of serious side effects, and when should a patient refer to their GP?
The one we really worry about is pancreatitis. That will give you severe upper abdominal pain going through to the back, often with vomiting, and everything's very tender. In those circumstances, you need to see someone immediately. That's emergency stuff. If people on another medication that can lower blood glucose can get low blood glucose symptoms, shaking, sweating, nausea, confusion. Those situations, you'll need to have your dose reviewed.
How to focus on long-term goal and lifestyle changes?
It's important to form good habits as part of your weight loss journey. The way you do that is you make small changes that you sustain for several weeks, and then you add another change on top. And the big changes are healthier eating and increasing your exercise, getting towards the Chief Medical Officer's optimum whilst taking the medication.